In order to understand increased intracranial pressure, you have to understand that our head inside, what we have is three different important things, which is the brain, the blood vessels, as well as cerebral spinal fluid. And in order to protect those three things, we have our skull, which keeps it encapsulated and protected from any kind of trauma on the outside. Now, when there is an imbalance, or the brain, the blood, or cerebral spinal fluid takes up too much space in this intracranial cavity, that means that there is a mismatch and that the patient will exhibit certain neurologic symptoms. So that could be, for example, a brain injury that results in a subdural hematoma, in a bleed. So now the blood takes over the space of that cavity and pushes the brain against the cranium, against the skull, which then will be increased intracranial pressure. It can also be caused by, let's say, a brain tumor. When the brain mass just evolves, it pushes the other brain tissue aside, and it also doesn't allow for the blood flow that the brain needs in order to act normally. And then we have the cerebral spinal fluid. So when there's an imbalance here, let's say from a hydrocephalus, for example, or from a spinal tap, or any kind of injury to the spinal cord where that cerebral spinal fluid might leak, then we also have that imbalance. So in order to really understand this, you have to understand the three different compartments that we have there, and that the mismatch of them can affect the other two, and then we will have usually signs of increased intracranial pressure, which always start with altered mental status, headaches, nausea, vomiting, those kind of signs and symptoms. So for more information on increased intracranial pressure and all the different disorders that can cause that, head on over to my YouTube channel and check the neurologic playlist.